Alright, good afternoon. I'm Katie Levin. I'll be your nurse practitioner today. I see here your name's Jacob. What would you like to go by today?
Jake.
Okay, hi Jake. So what brings you in today?
Runny nose, sore throat, and fatigue.
Mm-hmm.
It started like a week ago, and also wheezing and cough.
Okay. When did the wheezing and cough start?
The wheezing cough started 1 week ago.
Okay.
When wheezing and dry cough day and night.
Okay. So there's my next couple questions. Have you tried anything at home for it?
Mucinex helps a little with the green nasal drainage.
Okay. Anything make your symptoms worse or better?
Mucinex helps a little with the green nasal discharge.
Okay. Have you had this before? And if so, what helped?
A couple years ago, but I don't remember.
Okay. Do you take any medications?
No medication, only for like allergies, environmental allergies.
Okay. Alright, well let's see what's going on today and how we can help you. So first we're going to start with an assessment of your chest. So when we were talking, I was just watching the rate and rhythm. So your respiratory rate was 18, which is in perfect normal limits. Symmetrical chest exertion. There was no barrel chesting either. When I look at you, the AP to lateral is 2-to-1, which is in normal limits. There's no accessory muscle use when you were breathing in and out. So we'll go ahead and listen to your heart. I'm just going to turn this a little bit so hopefully they can see it better. Alright, so first we're going to listen to your aortic valve, which is the second intercostal space. Pulmonic, which is second intercostal space on the left side. Erb's point, which is right below pulmonic. Tricuspid, which is the fourth intercostal space on the left side. And the mitral. So I heard S1 and S2 with the normal limits. There was no murmurs or abnormal sounds, or S3 heard. So next what we're going to go ahead and do is I'm going to listen to your lungs, especially since you were complaining about wheezing in and out. So when I let you know it's okay, you can go ahead. You'll take a deep breath in and then out, okay? And then you'll do that every time I ask you. We're going to do that 8 times on your front. Okay, go ahead and take a deep breath in and out. Again. Okay. And again. Okay. Go ahead. We're going to listen over here. Okay, go ahead. Alright, we're going to repeat that same process but on your back this time, okay? So I can listen to the back part of your lungs. Deep breath. Deep breath again. Okay, go ahead. And again. Good. Time 6. 2 more times. 1 more. And 1 more. Okay, I did hear some inspiratory wheezing in your bilateral lungs in the upper chamber, lobes I should say. So we're just going to look at your eyes then. Go ahead and look straight forward for me. Alright, conjunctiva is a little bit red. We're going to look for a nystagmus, so go ahead and look face forward. 3 mm. Alright, there's no nystagmus seen. Your pupils are 3 millimeters in size and you react to light. Redness and dryness. Do you have any dryness, grittiness?
No.
Any double vision?
No.
Any difficulty like with blurry vision?
No.
Any drainage of your eyes?
No.
Okay, I don't see any foreign objects. Have anything gotten stuck in your eyes?
No.
Okay. The conjunctiva is red. There's no edema or discharge. The sclera is white. So everything's looking okay except the conjunctiva is just a little bit red. We're going to do the 6 cardinal gazes. I believe we did this at a previous visit. So I just want you to follow this light with your eyes only, okay? Alright, and that's with the normal limits, so that looks good. Next, we're going to go ahead and look at your ears. I'm just going to move everything so I can do this. Alright, let's go ahead and turn the light on. We're going to pull it up and back. Alrighty. Okay. And I'm going to do your other ear. Up and back. Ooh, okay. There we go. A little difficulty there, but I was able to see it. The auricle was oval, 6 centimeters in size, which is normal. There's no lesions. Did you have any tenderness when I was looking in your ears or when I'm feeling?
No.
All right. There's no deformities. Any pain or tenderness when I'm touching behind your ear?
No.
Alrighty. So, correct location. The auditory canal was pink and gray. There's no serum or earwax buildup. No discharge. No foreign bodies. Have you had any foreign bodies in your ears recently?
No.
Okay. The tympanic membrane was shiny, translucent. I did see the cone of light at 4 o'clock on the right side and 7 o'clock on the left side. The tympanic membrane was also oval and did concave inwards, as expected. So we're going to go ahead and look at your nose. I'm just going to feel first. Tell me if any tenderness. Any tenderness?
No.
All right. Nose is in is symmetrical. It's midline. There's no deformities or masses. No tenderness. No bone or cartilage deformities. Go ahead and press on one nostril and try to breathe out the other. And the opposite one. Patency of the nares is within normal limits. So we're going to go ahead and look at your nose. So up your nose a little bit. Go ahead and tilt your head up just a little bit for me. I'm going to press this up. Okay. Okay. Thank you. So red, dry nasal mucosa. You do have a deviated septum, which we did talk about in the past. Nothing to be worried about right now. We're going to go ahead and feel your sinuses. Let me know if you have any tenderness with those.
No. 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 No.
Okay. There's no swelling or deformities either on that. So that looks good. Next, we're going to go to your throat and neck. Any tenderness?
No.
All right. Trachea is midline. Color and symmetry is within normal limits. There's no edema or masses or deformities. I'm going to go ahead and palpate your thyroid. Go ahead and turn just a little bit for me. Yep. And I'm going to feel. And then go ahead and swallow. Okay. That is good. It's not enlarged. Can you circle your head for me? All right. No tenderness or pain when you do that or difficulty. All right, next we're going to do your lymph nodes. Let me know if there's any discomfort, and I'll let you know if I feel anything abnormal. So preauricular, postauricular is behind the ears, occipital, bottom behind the head, sternocleidomastoid is like the cervical, the notch, submandibular is the bottom of your chin, submental, anterior deep cervical chain, supraclavicular. Alrighty. No abnormalities for that. And you had no tenderness when I felt that?
No.
Alright. I'm going to have you open up and say ah with your tongue down and straight out for me. Go ahead. Can you stick your tongue down just a little bit? Alrighty. Thank you. So patient was able to say ah. There's no surface abnormalities in there. Tongue and palate was within normal limits. Uvula moves up when you were saying ah. You had your tonsils removed, correct? Mm-hmm. So I didn't see any tonsils. The wall of the pharynx was pink, smooth. There's no masses or deformities. So today I would say with everything we found in your symptoms, it would be an upper respiratory virus. Upper respiratory infection due to rhinovirus. And that's a viral infection, so you don't need any antibiotics. Viral infections can last between 7 and 10 days, so get lots of fluids, rest. You should be past the point of infecting others since it has been a week. But if you feel like it, you can still wear a mask if you want to be super precautious. I'm going to prescribe you an albuterol inhaler for your wheezing. You can take that as needed. I want you to also use a salt water gargle once a day or you can do it twice a day. I'm going to leave that one up to you. You can take Tylenol and ibuprofen as needed for discomfort. Just follow the instructions on the packaging for that. If you have any fever or facial pressure, or your symptoms seem to be getting worse before the 10 days, let me know and we can definitely follow up and see what's going on. Do you have any questions or anything?
No.
All right.